Yorkshire Radio.
We're talking about how men and women are attempting to reverse the ageing process and what we're doing to help us boost our careers. So if I can just start with you, Zack, can you just tell us a little bit about the research and were you surprised by what you found?
Seeing this day to day, I wasn't really surprised, but the research shows that nearly a third of adults within the UK have had aesthetic treatments in view of a change of job or career, indicating that youthfulness still equates to success in the workplace for many people. Of those adults, 1 in 5 women in the UK have been resorted to dermal fillers to maintain more of a natural, youthful look, as well to retain their beauty, with a significant increase in men as well uptaking these treatments.
Do you think that's quite surprising? Because often in the past, certainly in my experience, as you, I guess older people bring experience, authority, and perhaps if they're suddenly starting to look a bit younger, that might surprise people in the office.
I think that nowadays, in this day and age, there is some degree of pressure to look good. Maybe so more with certain industries, but the fact that this kind of work can be done in a natural way is very important for many people, and for them to feel confident, to look good, sort of bears a big influence really on the way they work. The fact that it's something that's being done more often is reflecting really its uptake and how simple this is to do and how effective it is as well. Interestingly, you're seeing a lot more people who are doing less surgical work. Back in the day, people would be having a lot more operative interventions to change the way they look. But with increasing discoveries of newer procedures that can be done non-surgically, things that are less invasive, things that can be reversed, things that are not permanent, all achieving the same look. People are resorting to doing that nowadays, especially when it's done safely as well, which is something that matters a lot to people these days.
It's something you see actually, isn't it, with some of the older Hollywood stars. You might not have seen them for a few years, and I just to mention one I saw the other day, where obviously they've had surgery and it's been quite invasive, and they physically they look quite good, but they also look like they've been in a wind tunnel. Lee Majors. I don't know if you've seen him recently.
I have seen him. Yes.
Wow.
Yes.
Well, he's had some work done.
I think that with surgical treatments, there is something when you have a surgical procedure and you don't like what you see, you're stuck with it for life, and that's I think something that's put a lot of people off. Whereas non-surgically, it's not permanent. If you don't like it, it will disappear. If it's something you really don't like, you can actually reverse it. So it's a good bridging measure for people that are considering doing something cosmetically. And if they do like what they see, there's that chance of doing it every couple of years or every few months with the neurotoxins, and you can achieve the same sort of look. And that's why you see people uptaking this kind of work a lot more. And you're right. I mean, as you say, people sometimes can look overdone. I think more so in the States than in the UK. We push more for a natural look in this part of the world.
Absolutely. Now, just to bring you in, Blair, how much do partners have in terms of persuading their respective husband, wife, boyfriend, girlfriend, whatever it might be, to have the work done? How much of a say do these people have?
Well, I think the research shows that it is a little bit of a persuasive aspect, is that if your partner suggests for yourself to get a treatment, the individual might be open to it. But at Intraline, what we want to do is make sure that we educate the people so that they make the right decision for them, and it's not a decision that their partner is forcing them into.
It's not just peer pressure, is it? It's a society thing as well. We see in media all the time, these perfect-looking people, but what's wrong with the odd wrinkle here and there?
I don't think there's anything wrong with the odd wrinkle. I think what we want to do is kind of promote a more natural approach to the aesthetics industry. And I think that can be achieved, and that's why we partner with programs like Derma Medical, because they take that approach to education. They want to kind of promote that more natural look where you just look a little bit more youthful rather than fake.
Is it all about, if you're thinking about this sort of thing, get as much research in as you can?
Yeah, I think for anyone, the key is research. It kind of lies both on the patient and the clinician side, as the patient has to educate themselves about the treatments that are available, the products that are available to them, and then mirror that when they meet with their physician to discuss the treatments, to ask the right questions to ensure that they're comfortable with the treatment that they're going to proceed with.
Just on that note, Just on that note, Paul, as well, there has been, although the industry is quite unregulated, there has been a push towards more of a regulation in terms of the consultation. Now, what we teach people really is that in the consultation, it's about planting the seed, which means not forcing someone to have a treatment, but to make them aware of what's available. And by doing that, really, we tend to sit down with the patient, we talk about the risks, what can go wrong, what can go right, and what really would be best for them. And that really bears in mind really what they want to do themselves. And then we tend to give them some time to think about that, giving them some information to read about. And only when they're really sure and we're happy to go ahead, that's when things tend to happen. So it's not just off the cuff. It's something that does require some thought and some consultation.
Absolutely. Now, if people do want to find out more information about what procedures they can or can't do, what they want to look into, the safety side of things, etc., where can they go for that?
So we have Derma Medical, www.dermamedical.co.uk is the training company for practitioners who want to learn about the procedures. But for patients or models that want to actually have this sort of treatment, there is a website, www.dermamodels.co.uk, where they can learn about every single procedure, how it works, how long it lasts, what can go wrong, and how much it really costs in practice.
Fantastic.
Sorry, just to add to that just to add to that as well, I think it's important to also, as the patient, to go to the actual product websites themselves. So whether that, we're not saying to use one product over the other, but to go to the kind of product website, that's where they're going to get information about the treatments that are available. And I think that's what Intraline does very well in partnership with Derma Medical, is to provide those tools for the patient to make sure that they're fully educated about everything that's out there.
Good advice. That's great stuff. Thank you. Zack and Blair, thank you so much.
Thank you very much.